The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Today on Aging Horizons, we are going to be talking about Medicare. What is it? How do you enroll in Medicare? And then what are some of the changes that are coming up in the future? We're going to talk to Janet Stillman. She's the SHIP director for the state of Montana, and she's going to give us a little bit of insight into this massive program and how it can help you and your family, and then some of the ways that you might be interacting with Medicare in the future. So make sure you stay tuned because you're not going to want to miss it.
You've probably seen some big-name celebrities on your TV lately talking about all the Medicare benefits you're missing out on. But the insurance companies who are paying for these ads may be pushing benefits not available in Montana. Fortunately, help is available from a friendly state health insurance assistance program counselor who can help you sort it all out. It's free, and we screen everyone for eligibility regardless of your zip code. It's Montanans helping Montanans. Call today.
Respite. It's okay to need it. It's okay to want it. Will you provide it?
The hard part about having outside help is that there's not a lot of people out there who can do that kind of work. We've been very fortunate that our Bonnie has been with us for 7 years. I don't know what I'd do without her. I need her in our lives. She's our second mother. And I can't help but think of her that way.
To find out how to change lives, including your own, call 800-224-6034 or visit respite.mt.gov.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
A decade of Montana fourth graders on Energy Share. If you're having trouble keeping your home warm this winter, Energy Share of Montana is here to help. We've helped thousands of Montanans who are having trouble paying their energy bills, and getting assistance from the friendly folks at Energy Share is only a phone call or Google search away. Energy Share is not a government program. It's neighbors helping neighbors who face energy emergencies. The Montana way. Call or visit our website today. Thanks to Energy Share, I'm cozy like a bear.
Welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Katie Lovell, and today we're speaking with Janet Stillman, who's the SHIP director for the state of Montana. Janet, thank you so much for being here
Thanks
today.
for having me, Katie. I'm glad to be here.
You know, I have done this Medicare show a dozen times, and then my mom turned 65, and it was like I had never heard the word Medicare before ever in my whole life.
Right.
So let's talk a little bit about what is Medicare.
Okay, well, Medicare is a federal program that is for people who are 65 and older or certain people with disabilities for medical coverage for their needs. So Medicare was started in like 1965.
Okay.
And it provided seniors and people with disabilities with some health insurance options for them. So there are two parts of Medicare. Well, there's a couple different parts, but there's Medicare Part A.
Okay.
And that is your hospital services. There's Medicare Part B, which is your doctor services and your durable medical equipment, outpatient type stuff.
Okay.
Some people hear about Part C. We're going to talk about that in a minute. And then there's Part D, which is a drug benefit. Prior to about 2003 was when the Medicare Modernization Act was passed. It was like the first major legislation with Medicare that made changes and finally included prescription drug coverage. So for 30 some years prior to that, there was no drug coverage with Medicare.
And that's such a huge need for seniors.
Right. So it's not perfect, but it helps, you know. So there's two ways to get your Medicare. Okay. You can go the traditional model, which is you get Part A, Part B, and a Part D plan. And maybe you pick up a Medicare supplement or a Medigap, they're called. Those are private insurance companies that help pay your the percentage of your medical bills that Medicare doesn't pay. So traditional Medicare is 80-20 split. So
Sure.
Medicare is paying 80, you're paying 20% deductibles and all that. So a Medigap or a Medicare supplement can help pay that 20%.
Okay.
Okay. So the other way to get Medicare is through Medicare Advantage plans. And these are pretty new. They came in about 2020, about the same time as that 2003 when the Medicare Modernization Act passed. But they are private insurance companies where Medicare gives us this pot of money and says, okay, well, you tell us that you can, administer their people's benefits cheaper, so we're going to give you this pot of money, and you Humana or you United Healthcare or whatever it be, Blue Cross, you take care of the medical bills.
Okay.
The person still has to pay a premium. Most people for Part A, most people have worked enough, so you've worked 10 years or 40 quarters, so you don't have to pay for Part A. You get premium free. And then Part B is for 2024, it's like $175, I think, this year.
Okay.
So it went up about $9 from last year. So, and that's every month. So whichever model you choose, whether traditional or the Medicare Advantage route, you still pay your Medicare premiums.
Okay.
So these health plans over here, they cover your A and your B, and they also have usually have a drug benefit with them, and they have to cover everything that traditional Medicare covers, but they might cover it a little bit different, and they can include some extra stuff.
Sure.
So with original Medicare, you're 80% Medicare pays, 20% you pay for the whole year. Over here in the Medicare Advantage plans, you have they have maximum out of pocket. So once you reach a certain limit based on the plan and whether it's in-network or out-of-network services, it's a maximum that you have to pay, and once you hit that, the company pays the rest of it. So let's say the out-of-pocket maximum is $5,000.
Yeah.
So you go in and you have a $100,000 surgery, you're only going to be responsible for $5,000 of that.
Yeah, that's so
and that
helpful.
company will pay the rest. So, there's advantages and disadvantages to both of them, and it's just really important that people, really think what they want to do and what options they want to follow. And you can always call a SHIP counselor in Montana, and they can help guide you through that and help you look at traditional versus a Medicare Advantage and what's best.
And what are some of the things that people need to think about when they're making that decision? What are some of those factors that you might be thinking about?
Right. Well, what is their health like right now?
Sure.
Is there with traditional Medicare, you can go to any doctor that takes Medicare. Mm-hmm. With a Medicare Advantage plan, most of them have in-network doctors.
Sure.
So you're going to need to know, is my doctor in the network?
Yeah.
Because if he's not, it's either not going to be covered or it's going to be more expensive.
Sure.
So that would be one issue. And then also just over here with Medicare Advantage, on top of your A, if you have to pay A or B, there's usually a little premium over here too. It's usually not very much, but so you just need to kind of look at the options. And also it comes down to what drugs you take. Are you going to be better on a Medicare Advantage plan? Is it going to cover your drugs better than a standalone prescription drug that you would get over here with traditional? So.
Absolutely, and I assume those prescription drugs is a huge cost for some folks and a big determining factor.
And it really is. And in the beginning, when it first started, it was like they'd get so much relief, and then they'd fall in a donut hole and come out on the other end. But since the Affordable Care Act or Obamacare, they closed that coverage gap. Wow. So people are seeing more help while they're in their coverage gap. It changes who pays what, and your costs may go up a little bit in that coverage gap because it's dependent on behind the scenes stuff, but at least you're not paying 100% of your costs like you used to.
So helpful. All right, when we get back, I want to talk a little bit about enrollment periods. How do you get on to Medicare? So make sure you stay tuned, because we're going to talk about how you may be approaching the age for Medicare, how you're going to look at what plans to choose, and how you're going to get onto those. And we're going to talk a little bit about special enrollment periods. So make sure you stay tuned to Aging Horizons.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
45 years, 2 packs a day. It's like $80,000. I thought I was just hurting myself until I fell asleep in a chair with a cigarette. The whole house went up. I lost it all. I knew smoking was expensive, but I never thought it would cost me everything.
Welcome back to Aging Horizons. We are speaking with Janet Stillman, and we are talking all about Medicare. So, Janet, I know that there's the way that you get on Medicare traditionally, which is you turn 65, but there are other ways that you can enroll in Medicare at other time periods.
Right.
Tell me a little bit about them.
So the big one that we just got through was annual open enrollment, and that was October 15th through December 7th. That's when everybody on Medicare has a chance to either change their Medicare Advantage plan or go back to traditional Medicare or change their prescription drug. And it's such an important time because, things change every year.
Yeah.
So we're through that, which is a busy time for everybody. So they should be have all their information for their new plans and whatever started January 1st. So some initial enrollment is when you first become eligible for Medicare, you have a 7-month period. So you have 3 months before your 65th birthday, the month of, and 3 months after.
Okay.
So depending on when you sign up during that 7 months, if you sign up the 3 months before, of course, it's not going to start till your 65th birthday.
Sure.
But let's say you sign up the month of your 65th birthday, it'll start the month after.
Okay.
So that's called the initial enrollment. Also, we're in 2 open enrollments right now. January 1st through March 31st is the Medicare Advantage open enrollment.
Okay.
So in case you didn't change plans or you didn't get that looked at, during this period you can change to a different Medicare Advantage plan.
Okay.
Or you can go back to traditional Medicare and pick up a Part D.
Okay.
One thing you can't do is you can't go from original Medicare to a Medicare Advantage during this time frame. So that's a unique enrollment time. The other one that we're in the middle of too is general enrollment. So that means that if people didn't sign up for Medicare when they were first eligible for it, January 1st through March 31st is called general enrollment period, and you can sign up for Medicare. It'll start the month after the month after you sign up. So it used to be that they could sign up during this period, but it wouldn't start till July 7th, or July 1st, so they'd have to wait. But this year, one of the changes through, I think it was the Inflation Reduction Act, is that it's going to start the month after.
Oh, that's
they
very
enroll.
helpful for folks.
So there is also different times during the year, like if you were working and you put off getting Medicare right away because you had insurance through your employer, there is special enrollment periods to get into Medicare once your insurance ends.
Okay.
Also for incarcerated people, this was a change too. If they lost their Medicare while they were incarcerated, they have a special enrollment period to pick up their Medicare. I think it's a year.
Okay.
To pick up their Medicare when they get out. And that's so important because it used to be that they might have to, if they got out in May, they'd have to wait until January to get in. And that's like setting people up to fail right there if you don't have medical
if you don't
help.
have health coverage.
Yep. So those are two important times. As far as drug benefit, most people, they pick a plan, they're stuck in that plan for the year.
Sure.
But there's a lot of people there's a lot of what's called special enrollment periods for these folks, and there might be a reason they can switch midterm.
Okay.
So maybe they're getting extra help or help with their prescriptions. Maybe they're on Medicaid. Maybe they move from one place to another.
Okay.
Maybe they qualify for Big Sky RX, which we're going to talk about next segment. There's just a bunch of different reasons, and so if you're interested mid-year and you're not happy with your plan, reach out to a SHIP counselor and they can help guide you through that process and see if there's a reason we can get you into a different plan.
That's so helpful because I know there's no way your normal average person is going to have all of those enrollment periods on their calendar.
Right. And SHIP counselors are just a great resource in our state. There's over 125 SHIP counselors, and they're located in every county. They may not live in the county, but they cover that county.
You know, I think we always say call your SHIP counselor, but I don't think I've ever really even asked you, what is a SHIP counselor?
A SHIP counselor is just somebody that is trained, that works, most of them work for the area agencies on aging.
Okay.
But we're seeing a lot of folks from community health centers, IHS that are getting trained in it.
Sure.
Sorry. And they come through training and they get certified. They learn all about Medicare. They have to do like 18 Medicare modules prior to class, and then they come sit in class for 2 days, and then they take a test, and then they get certified.
Yeah.
And then every year they're required to do so much training.
Sure.
And go through an annual recertification training, and they have to read all the emails they get from me.
Absolutely. Do you have to pay a SHIP counselor when you reach out to them?
No, we are free. We don't work for insurance agents, so we're unbiased. We're not even going to tell you to go to a certain agent. We'll say, hey, who does your friend go to? Who do you have your homeowner's insurance through?
Sure.
Do they do Medicare? We're never partnered with a insurance agent.
That is so helpful to be able to find a place to get honest information where you can compare your plans, and they can walk you through the different things that you might not even think about when you're choosing a plan. I know it can be a really stressful period of time for folks.
Yeah.
How do I know if my doctor's in network? How do I know if my drugs are on this specific plan? So those SHIP counselors are just invaluable.
Yep, they are. They're great.
All right, when we get back, I want to talk a little bit about some of the changes that we're going to see in Medicare, and then those helping programs, because they're so amazing. Yeah. So make sure you stay tuned, because we are going to talk about the ways that Medicare can be costing you money, and there may be a way that you can get some help with those bills, because those are important, and we want to make sure that you're getting all the coverage and all the assistance that you possibly can. So make sure you stay tuned, because you're not going to want to miss that important information.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself, so my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
Can you say ombudsman?
Ombudsman. Benson?
Uma Doodlesman? Fortunately, you don't have to say it right to get the help of a long-term care ombudsman. If you or a loved one reside in assisted living or long-term care, an ombudsman can help resolve any issue. And these services are completely free and confidential. Now, why don't you try that again?
Ombudsman.
I was the last guy you'd expect to get diabetes. I was a competitive runner and I always took care of myself. So when I was diagnosed, it kind of threw me. But it's really encouraging to know I'm not alone with it. There are a lot of other people going through the same things as I am. It takes some effort. You have to keep after it. Exercise, meds, and diet are the key. But there are a lot of folks who want me to succeed. Diabetes is not the end of the world. With effort and attitude, you can have a normal life.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Welcome back to Aging Horizons. We are speaking all about Medicare today with Janet Stillman, and she has told us a little bit about what Medicare is and the different programs that you might be on, the enrollment periods in which you can sign up for Medicare, and now we're going to talk a little bit about the changes that are coming in 2024 and some of those special helping programs. So, Janet, there are changes that are happening this year to Medicare. Let's talk a little bit about some of those.
Right. So some of the changes are, of course, the Part A and B premiums went up a little bit, $9, I think, about what it is, and the deductibles went up about $20.
Okay.
For both those programs. The other change is that for the drug benefit, if it used to be that once you got through that coverage gap or that donut hole, you'd be responsible for 5% of your medication costs, and Medicare would pay the other. Well, starting this year, January 1st, it's zero cost to you once you get out of that,
Wow.
once you get into the catastrophic level.
Sure.
So that's going to help. The other one is that those people that are on low-income subsidy, there used to be partial subsidy and full subsidy.
Sure.
So those on partial subsidy would have to pay a portion of their premium. They'd have like a $99 deductible, and they'd pay 15% of their drug costs. Well, 15% of their drug costs could still be really high.
Yeah.
So starting January 1st, so back on January 1st, anybody who used to be a partial eligible for low-income subsidy is going to be considered full. So they're not going to have to pay a premium.
That's
as long as they
amazing.
get in one of the zero premium plans. They're not going to have a deductible, and they're going to get the co-payments that people on full. So anywhere from $1 to, I think it's $11 or something. So on covered prescriptions. So
That is so helpful for folks.
yeah, and that opens us up to the low-income subsidy program.
Sure.
I love talking about the Medicare helping programs
Yeah.
because I've seen how much it can help. So the low-income subsidy or extra help program, it's thought, they say the average help that somebody can get is like $5,000 a year. That's the average.
Wow.
But as SHIP counselors, we've seen that's incredibly high. We've seen people save $200,000, just because of certain medication.
Sure.
So it's for limited income and resource folks, and it helps with their prescription drug costs. So,
Okay.
and instead of having, all the way through the year, they should be paying $1 to $10, $11 per prescription, as long as that drug's on the plan formulary.
Yeah.
And there's certain plans that are called zero premium plans. So if you get in a zero premium plan, you won't have a premium with that plan, okay? But those plans aren't always the best for folks because they may not cover your drugs. And
Sure.
so you may have to go to a premium-based plan. But if you're on extra help, that's still going to pay a portion of your premium. So that is a great program. It really does help people with their prescription drug costs.
And where do folks go to apply for that?
Well, they can go to the socialsecurity.gov website.
Okay.
There's a place to apply there. SHIP counselors can help you apply. It's a real quick 10-minute application.
Wonderful.
So Social Security is the one that determines whether you're eligible for that program, but we can sure help with that, so reach out. Another one is if you're on low-income subsidy, you get a special enrollment. If you don't like your drug plan, you can change a couple times a year because you qualify for that program.
That is so helpful for
So,
folks.
yes. And the next program that I love to talk about is the Medicare Savings Program.
Okay.
It is administered through the Medicaid office in Montana. Even though it's a Medicare program, what it does is it helps to pay those Medicare B premiums.
Okay.
We have $175, whatever it is this year. So boy, that $175 a month back in your pocket, that is huge for people. And if somebody with a really lower income qualifies, that program will also pay their Part A premium if they have a Part A premium. And that Part A premium, like I said, most of us have premium-free Part A, but that person that has to pay their premium, it's $500 a month.
Oh my goodness.
So one of these programs, if they're eligible, will be able to pay for that. So
that's so helpful for folks.
Yep, and so those are great. There's three different levels of that, and they're just wonderful. And they're an average savings of like $2,200 a year, just in those premiums.
That makes a big difference.
What could you do with $2,200?
Absolutely, that's a lot of groceries.
Yeah, so that's a great program. The other one I want to talk about real quick is the Big Sky RX program. It's the Montana Grown program. It was started during the Schweitzer administration, and it's just a program there to help those folks that usually fall through the cracks, that make a little bit too much income to qualify for stuff, but it will pay, if somebody's eligible, it will pay their Medicare Part D premium up to like $38 a month. So
that's wonderful.
That's great. And they have a higher income level, and they don't look at the resources. So if you have 10 cars and campers and boats and, but you're under income, you can still get that program. So that's a great program too.
Really wonderful.
Yep. So those are the helping programs, and I love to talk about them. And
They're so great.
And I really encourage people to look into those and apply for them. They're there for a reason. They're not welfare. They're not a handout. They're a hand up.
That's so important.
Yes.
Janet, one thing I wanted to ask you about before we close is those commercials that we've all been seeing about signing up for Medicare, and tell me a little bit about those.
Right. They are like on this every TV station
Yes,
every minute.
12 seconds.
Those are national commercials that are put on, and they're put on by groups, but SHIP counselors can do that free, here.
So important.
And we're going to look at an individual approach to you, look at you as your whole person, and, see what's going to work best for you instead of pushing these Medicare Advantage plans that they're talking about on TV that may or may not have the benefits that they talk about in, here in Montana. And again, those are insurance agents that are getting paid to enroll you in something,
Sure.
and we are non-biased, and we don't have any skin in the game, so we just care about getting you in the best plan for you. We're never going to tell you what the best plan is, but we're going to help guide you to make that decision.
Absolutely.
So yes, call us. Please call us at we'll put the number on the screen, and we're free, confidential, and unbiased.
Absolutely. Those SHIP counselors are just such a service to their community.
Yes.
So helpful. Well, thank you so much for being with us today and giving us all that important information. I hope that you learned something about your Medicare coverage, and most importantly, I hope that you learned that if you need any assistance with your Medicare or have questions, call a SHIP counselor, because they really are there to help you. They are unbiased, and most importantly, they're free. So make sure that you give them a call, and thank you so much for staying tuned to Aging Horizons.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.